Thank you for joining us on Coffee Break, brought to you by the Middle Alabama Area Agency on Aging, or M4A. M4A is a part of a network of 13 area agencies on aging that cover all 67 counties across the state. We are located in Alabaster, and we cover Blount, Chilton, Shelby, St. Clair, and Walker counties. We would love to find out how we can help your family today. For previous episodes of Coffee Break, feel free to check out our YouTube channel. All right, we're going to go ahead and kick things off. If you join us late, be sure to, if you have any questions, make sure you drop them either in our chat box or in our Q&A box, as well as we're streaming this live on Facebook. So if you get to the party late, don't be too unhappy, because we're actually recording this, so you'll be able to refer back to it. Or of course, if you're on social media on Facebook, you can always refer back to it. Typically, it's usually after we get done with the live feed, it's usually available right afterwards. So it shouldn't be too long of a wait if you come in too late to the video. So have no fear, you should have pretty quick access to it to get caught up pretty quickly. So we want to welcome everybody into session 16 of our Coffee Break series. We've had these going on since the early days, which seems like forever ago, the coronavirus. Back in late March, we started these. And we've really been doing one of these every other week ever since. So we're happy to keep these going, and we're glad that you decided to join us today. Again, we will be streaming this live on Facebook. So if you have any questions, just drop a question on there or a comment, and we can always refer back to our panelists if it's a question that they can answer. If not, we'll make sure to get it to them afterwards and make sure that we can get it answered at a later time or as quickly as possible. As far as Zoom, those that are in the that RSVP that are here live with us now inside the Zoom chat feature, this is a webinar format, so we are doing this in a fashion that you can't necessarily talk to us as a participant, but you can ask questions in the chat feature as well as the Q&A box, and we're monitoring those as well as our social media feed if a question pops up as we go along. So again, thanks for joining us, and we're going to go ahead and get started. Coffee Break is brought to you by two of our in-house programs at the Middle Alabama Area Agency on Aging, also known as M4A. The PANDA project, which is providing Alzheimer's and dementia assistance, and the Alabama Cares Caregivers Support Program. We will go over those a little bit more later on in the presentation after our guest speaker gets done today. And so hang around for that, and we will go over those two as well as many other programs that we offer through M4A. So today we want to welcome guest speaker Justin Johnston, who's the Executive Director for the Community of Hope Health Clinic located in Pelham. And I'm going to pass it along to him. And again, just before Justin gets started, for those of you who may have just joined us, if you have any questions, feel free to utilize the chat feature or the Q&A if you're with us today on Zoom, or if you're on Facebook. Make sure that you drop a line on the comments under the video, and we can make sure that we get any questions back to either our staff or Justin. So without anything else to do, Justin, I'm going to pass it on to you.
So what is the Community of Hope Health Clinic? So the clinic was founded in 2008 by a group of church leaders and community leaders who saw the need for better access to care for the adult population of Shelby County. So one of the things that I normally talk about whenever I'm discussing the Community of Hope is, in the state of Alabama, because Medicaid has not been expanded, it is much easier to get a child or a senior citizen health care. And with the Community of Hope Health Clinic, what we try to do is we try to bridge that gap between the two. So we're a medical mission for non-emergent medical care in Shelby County, and we see patients between the ages of 19 and 64, and they don't have health insurance, or they don't have access to programs such as Medicare, Medicaid, or VA benefits. And they don't have, like I said, they don't have private insurance. Also, we see people, and this is a number based off of federal guidelines and based off the number of people in a household. we see people who are families who are at or below 200% of the federal poverty guidelines. And people are always asking me why 200%. 200% is a pretty standard practice for places that are free and charitable and mercy hospitals. So right now, the Community of Hope Health Clinic, we operate clinic 3 days a week. We do it Monday and Tuesday mornings from about 8 to noon. We also operate Thursdays from 5 to 8:30. Once a month, we do a Monday evening clinic from 5 to 8:30. And one of the things that we're looking about doing here shortly is actually opening up every Monday night from 5 to 8:30 and offering prenatal services geared towards a Latina population. With the exception of myself and 3 other staff members, we're completely volunteers. So that means all of our doctors, all of our nurses, anybody else who does triage, anybody who does our interpreting, and then we have general volunteers. They're all volunteers. So right now, I would say we have a pool of between 60 and 75 volunteers who volunteer whenever they can. So, and then we're one of those organizations that is we're at the mercy of volunteers. So anybody that's working nonprofit knows exactly what I'm talking about. So who do we see? So generally, I work by reporting numbers to different organizations. We work on a rolling calendar year. But most of the people that I talk to and I report to, I have to do on a fiscal year. So what I did is I gave, as far as our patients go, the total number for the last fiscal year, which began October 1st, 2019, and just a little more than a month ago ended on September 30th. So as you can see from my presentation, we had a total of 1,646 visits throughout the course of the year. And that was actually an increase of 340 patient visits from the year before. Now, this is significant because when COVID-19 hit, we actually shut down for 2 months. So that just shows what needs were before. And then with the economy doing like it's been, jobs being lost, everything being shut down, people losing their health insurance, we're actually seeing an increase. We've also done other things such as COVID testing, and we've done a health fair with another one scheduled here fairly soon. As you can see, that second line under total patient visits, that's the unique patients. So while we had a total of 1,646 patients come in through our clinic last year, we actually had 1,171 different patients, and some of those may have came multiple times to hit that 1,646. That's a 524 person increase. So what that means is that from October of 2018 through September 2019, we only had about 650 patients that came through. So you can see that through different areas, especially through this pandemic, we've had to see more people than what we normally wouldn't see. Because of our increase, we have to have the volunteers that are there. So as you can see, this is actually for the current calendar year. I wanted to talk a little bit about in-kind hours. In-kind hours are the hours that of course, our volunteers are giving us free of charge for their services. And you think about how much an MD makes or how much a nurse makes. This ends up accumulating quite a sum of in-kind volunteerism. And to date, for this year, from September to January to September, we've had over 1,418.5 hours of volunteer work done at our clinic, and that accumulates to services of $106,489, which means that if we were not getting volunteers, that's essentially what we would be on the hook for as far as being able to provide these services. Now, one of the things that I really didn't include on this presentation is talking about what we do when somebody comes in and they need to see a specialist. So we run primarily as a primary care facility, and but you know, we see people who are quite healthy and we see people that are very unhealthy. And so when somebody comes into our clinic, they may need to see a cardiologist. They may need to see a podiatrist. They may need to see a gastroenterologist. And that does not include those numbers that I just showed you, that $106,000. That does not include the services that come from all of our referrals that we give to those specialists. And the good thing about coming through the Community of Hope Health Clinic or any of the other free and charitable clinics that are in the state of Alabama is we can usually get the specialist services for free or little cost to the patient. So when you think of I think we had 130 or so referrals last year. You think about those 130 people who went and saw specialists, which generally are more expensive when it comes to healthcare, and just say that they got $1,000 worth. I mean, that's another $130,000 if that was the average. I can't tell you the average. What I'm just trying to say is when somebody comes in and they need a specialist, we're able to get them in for free or little cost. So a little bit more about our numbers. Right now, our providers in 2020, we have 15 total providers. 10 of those are doctors. We have 1 physician assistant, 2 nurse practitioners, and then the last 2, the 1 physical therapist and the 1 chiropractor, those are new services that we've added this year. We're trying to expand our services always. And when you're dealing with patients who are chronically ill, maybe they're overweight, or they have diabetes, or they have, orthopedic issues, we're trying to find alternatives to combat things like the opioid crisis that we've had in the state of Alabama recently. And so one of the things that we can do is we can put our patients now through physical therapy with the hopes that the physical therapy will allow them to go back and live somewhat normal lives, if not all the way what they were. Other volunteers we have many longtime nurses, former students who are nurses. We partner with the Jeff State Nursing Program. I have internships from UAB, Sanford, and Birmingham Southern. It's great being where we are. And actually, for anybody that's within the Birmingham metro area, we have a lot of services, a lot of students that we can pull from to make sure that our staffing needs and our volunteer needs are met. And then, of course, we got general volunteers. One of the things that I've done as a executive director is gotten community leaders in, lawyers, bankers, Hispanic leaders, and whatnot. So one thing that I don't know if I put this on here, we are 65% Hispanic at the clinic, and we're about 30% Caucasian and about 5% African American. So the need for volunteers, specifically those who are looking to go into med school, those who are looking to go into specializing in medical interpretation, it's important for us to pull from those different universities within the area. And we also have Montevallo as well, the south of us. So we've got about four or five different places that we pull from. So the question is, how do I become a patient, or how can I find my aunt? How can I get them an appointment, or how can I get my cousin or my nephew or my neighbor? We have an intake screening process. We used to do this in person. Since COVID has started, we've made it a lot easier for our patients to become a new patient. So what they would typically do is they would call our office, which I've put the number on there, 205-644-8640. And we would, when they talk to whoever they want to go to, they would be mailed an application. The application would need to be filled out, and then in order for them to become a patient here, they would have to submit what we call proofs. Proof would be like a utility bill saying that you lived in Shelby County, a proof of income. We also have different ways that we can get around that. Food stamps, if somebody, is in the SNAP program or on Medicaid, I'm sorry, if they're on the SNAP program, not Medicaid. If they're on the SNAP program, they're automatically qualify for financial reasons, or we can get a notarized letter, and that allows them to come in. And so that's it's pretty simple. From there, the process, all the information is processed by one of my clinic coordinators. We talk with the patient. The reason we run our hours and our clinics like we do is because we do Monday and Tuesday during the daytime, and then Thursdays an evening clinic. So we try to accommodate those who can come during the day, but also those who work, and then they come for an evening clinic. And so we talk to those particular patients. We ask them to choose a day or night. And then once they get to that, we try to keep them in that particular slot for a good continuity of care, so they make sure that they're getting the same health care from the same provider each time they come in. So once that paperwork's filled out, once we get that information from the patient, they can usually see a primary care provider within 1 to 2 weeks. When, I guess about 2 years ago, we were at 6 to 8 weeks. And we've been able to whittle that down to 1 to 2 weeks. So if you come in, or you call and say, I need somebody, and you get everything like you need to be, usually next week we can see you. We are a primary care facility that does not see acute injuries. So that means if you need an emergency room or urgent care, we don't operate as that. But it's something, but if it's something that needs to be chronically maintained, like diabetes, high blood pressure, high cholesterol, gout, and other different comorbidities, different illnesses, then we get our patients in, and our doctors will treat them long term to make sure that they don't have to go to the emergency room. So one of the things that I also get is I talk to a lot of people. I personally live in Blount County. I work in Shelby County, so I drive, almost an hour to work whenever I do drive. So I talk to a lot of people in Jefferson County. I talk to a lot of people in St. Clair County and Blount County, and they say, well, you only see people in Shelby County. Well, I'm also the vice president of the Alabama Association of Free and Charitable Clinics. And the thing about that is we have a state group, and we have a state association that has a website that's on there on my screen right now. It's alabamaclinics.org. And if you go in there, you can find a clinic that's near you. I know there's quite a few in Jefferson County. I know there's one in St. Clair County. I think the ones in Jefferson County do see patients in Blount and maybe Walker. I would just call before, I'll go and look at it. We have the Empower Ministries is probably one of our bigger ones. And that one, you can always call them and see if they'll see you. The new one in St. Clair County is in Pell City. But if you go to that website, that will direct you to who to call. And if you have family or friends that live in other parts of the state, we are scattered from Muscle Shoals to Huntsville to Birmingham to Montgomery to Mobile. We're everywhere. There's 14 of us across the state, and they can use that as a way to get health care. So let's just say that you would like to help, or somebody who would like to help us. We're always looking for new volunteers. So somebody at church, or you yourself want to do it. We're looking for medical providers. We'll never turn a medical provider down, because the more medical providers we have, the more prospective patients that we can see, the healthier our county is and Alabama is in general. Also, we're looking for people who are nurses, triage, people who can speak Spanish is a huge thing for us. And then just general volunteers. A lot of people will say, I can't do that. I'm not medically trained, or I can't do this, but you can help us work the front desk. You can help us file papers. There's a whole lot of stuff that general volunteers can do. One of the other things that we do is so the way our schedules are set up with that Monday and Tuesday and then Monday, Tuesday mornings, and Thursday evenings. Mondays and Tuesdays are typically your new doctors or new nurse practitioners or retired. And so they're either looking for experience or they're looking for something to do. And so typically they're in the morning and they're out by lunchtime. Our evening clinics are a little bit different. Most of those people, most of our doctors and nurse practitioners that come in the evening time, they're leaving their 8 to 5 practice. And so they're coming in, they're leaving that at 5 o'clock, coming to our clinic, being there by 5:30, and they work another 3 to 3.5 hours. So one of the things we do with the clinic is we try to provide them with dinner. We have different civic organizations, different fraternal organizations, church Sunday school groups, and they provide meals for our volunteers on those evenings. And this is something that I think is pretty common across the state with the different clinics. So we just try to do that just as a thank you for, you know, taking time away from their families and home and going from working an 8-hour shift or 9-hour shift and possibly working as long as 12 hours. And so it's just something that we've done. We've always done it, and we're going to continue to do it whether or not we have it. So if you know somebody who's willing to do this in the area, be more than happy to speak with them. We also take monetary donations. People are always asking about how can we give. I have a PayPal email set up at justin@communityofhopeclinic.com. Checks or money orders can be mailed to the address on there at P.O. Box 177, Pelham, Alabama 35124. And all donations are tax deductible as we're a 501c3 organization. You know, I get my audits and financial reviews, and so all of our money is in good hands and it's used correctly. But that's one way that can be somebody can help us. And then the final point is, I mentioned that we're at we're right next to Pee Wee's Pawn Shop in Pelham. This is a new venture for us. For 12 years, we were in the Shelby County Department of Health, and we felt it was time to expand. And so I just put a few pictures up here. That one thing is we needed the room so we could grow a little bit and also expand our services. And Jeremy, you can go to the next picture. And then you can kind of see some of the inside and some of our volunteers at work. We're trying to make it to where when we have a patient comes in, they're not paying a thing for our services, but we don't want them to come in and feel like they're in some sort of subpar medical clinic. We want them to walk in and say, this is like any clinic, any paid clinic in the state of Alabama. And so that's our goal, and that's one of the things that we did. So all our information is there. If you live in the Pelham area and would like more information, you can always stop by. You can email me on that PayPal address that it was on that last page or like 2 pages ago, or you can visit communityofhopeclinic.com to get more information. So I guess that's really what we do. You know, it's a great organization. I've been there 5.5 years, and I love doing what I do because I know that the people who are getting the health care that they get are getting it because they have nowhere else to go. And it's just, I feel like that's one of our callings as being a faith-based mission. And I really appreciate just the opportunity to tell you a little bit about us today, and I'll be more than happy to answer any questions that may come about because of this.
Jennifer, I don't know, I don't see any in the chat window or on the Q&A. Do you see any on our Facebook feed at all?
No, not with me.
As always, that means you answered all the questions, Justin. First, I mean, I'm just blown away personally. I know that you kind of touched on, this is kind of the way it is across the board with the other agencies, but this alone makes me very proud to work and live in Shelby County. This is just a wonderful, the magnitude of the amount of people that donate their time, their energy every day. And then, that alone, and then you have the director of the overall mission driving an hour to come to work is just phenomenal. That there's so much passion and desire to help our communities is just phenomenal. And I really hope we can, we can do our part in this, our little organization. Maybe we can help to promote and get the word out about the Community of Hope Clinic, because this is just an absolutely, it's crazy to me that it went from 6 to 8 weeks to see a doctor that you guys, I mean, it looks so easy and it sounds so easy the way that you presented it in such a short amount of time. But I know that took a ton of energy, a ton of man hours, a ton of free man hours. And it's amazing to me, the work that you guys put in, and obviously is showing, because you've moved, you're growing, and I really hope that our communities continue to support. We did have one question come in. It says, for patients who may require medications based on their visit, do you have a resource available for them? I think you might, I don't know if you're trying to talk, Justin, but you're muted. So.
Can you hear me now?
There you go.
Okay. So Tiffany, that's a good question to ask. Well, I get this question quite a bit. So most of the free and charitable clinics within the state of Alabama have in-house dispensaries. Currently, Community of Hope does not. One of the things that I'm hoping to do beginning in early 2021 is to work with the McWhorter School at Sanford to possibly get a dispensary put into the clinic. We have a room that's available there. That was one of the motivations for moving to our new space. And with that, when we do that, we're going to work with different groups like AmeriCares and Dispensary of Hope in Nashville to get, it's a small nominal fee that we'll pay, but the return on investment is something like, I want to say the fee is like $7,000 per year, but the return on investment is like $225,000 in drugs that I'll be able to order within a calendar year. And our patients will get that for free. But it's really, for right now, I'm in the planning processes because there's a lot of MOUs, memorandum of understandings that come with that. And there's a lot of paperwork that has to go into starting something like that. Now, as far as what do our patients do now, generally, we do not prescribe narcotics. That's one of the reasons that we are doing physical therapy and whatnot. As far as controlled substances go, we do, on occasion, some of our providers do have a license to prescribe controlled substances, but as a general rule of thumb, we do not prescribe them because there is a huge crisis going on with different people who become addicted to controlled substances. So we do our best to stay away from those. Our providers will prescribe what we call frontline or first line medications to help our patients control, say, their diabetes or high blood pressure. Now, in some cases, and then that's something that you'll see a lot in a paid clinic. Somebody comes in for the first time when they've got uncontrolled diabetes or uncontrolled high blood pressure. What they're going to do is they're going to try them out on something to see if it works. And if it doesn't work, they go to the next medication. Well, we try to do the same thing, but sometimes those $0 and $4 prescriptions that you can get at Walmart or CVS or Publix, they don't work. And so my staff, some of my volunteers, my interns, we also help out with patient assistance programs through the drug companies themselves for more of the newer medications. So some of those medications may cost $1,000 or $1,500 per month. And we work closely with groups like Shelby Emergency Assistance to kind of bridge that gap to get the paperwork in. And generally our patients will get a year of free medication through the drug companies as long as we have all of our proverbial T's crossed and I's dotted. So right now we do have a plan for when our patients come in. It's typically on the $0 and $4 list at the various drugstores. And if we need to, we will do the patient assistance program for some of the newer medications. And those are usually ones that don't have generic prescriptions.
Thank you for that, Justin, and thank you for the question. The next concern that I had, Justin, was I'm assuming that those pictures of the new office you took were fairly recent. Did I see Christmas trees already put up at the beginning of November, or did I see that wrong?
So my staff, they decided they wanted to do a holiday tree that will keep it up year round. So each holiday they have a different theme. So during Valentine's Day this year, we had hearts and different Valentine's theme ornaments. For Easter, we had Easter eggs hanging. 4th of July was a red, white, and blue. And then one of my personal favorites, during football season, we had a football tree. And so we just took down all the stuff that we had, ghosts and witches and things like that for Halloween. And now we're about to do a Thanksgiving/Christmas tree. That's just something my staff wanted to do. And I said, you know what, if y'all want to do that to keep it festive here year round, you can do it. So
hey, we throw everything out the window in 2020. I mean, you do what you do at this point. So thanks again, Justin. We really appreciate it. And again, if you didn't catch all of Justin's presentation, of course, we're going to be recording this, or we are recording this. We'll be putting it on our YouTube channel, but it will be available immediately after the live video ends on our Facebook page. So feel free to go back and get any contact information, find out any information about volunteering, or if you have clients or you personally or a loved one needs to see about getting some assistance through their organization, feel free to reach out. So we're going to go ahead and move on. Go ahead.
Can I say one last thing is if you do know somebody who may not qualify, or they may have Medicaid or anything like that, you can always give us a call. We have lots of resources that we can point people in the right direction. So we're not going to just turn somebody away. We're going to help and make sure that they're going where they need to go.
Very no wrong door, and trying to help everybody mission. I love it. So thanks again, Justin. It's an awesome presentation. I really appreciate it. And it's really great to know that organizations, because honestly, I knew about you guys, obviously. I know you personally and with different events that we've both been at, but I really had no idea that there was that sheer amount of hours and donations that have been given in this short amount of time to the organization. And that's amazing. I mean, it sounds like less of a volunteer effort and more of a family effort. I mean, it really sounds like everybody gets along and works wonderfully together. And I mean, that just blows me away. I mean, we're an organization of many, and it's hard for us to grab volunteers. And I'm just mind blown at the amount of effort that you guys get and donated in-kind donations from the community. That's just a wonderful thing. So if you have any questions for Justin, of course, like I said, reach out to him, drop us a question in either here on Zoom or on social media, and we'll be sure to get that back to him. But without anything else, as far as the Community of Hope Clinic goes, just be sure to donate your time and money if you want to donate it to a worthy cause. They sound like an excellent organization, so be sure to check that out during this holiday season. All right, we're going to move on to M4A services now. We are the Middle Alabama Area Agency on Aging, also known as M4A. And who are we? We are a network made up of 13 area local agencies on aging that cover all 67 counties in the state of Alabama. As you can see there, we're kind of nestled in the center, just under Birmingham and Alabaster and Shelby County. However, we cover 5 counties in particular, but we are kind of right here nestled in the center, and you have all scattered all throughout the state that really covers every corner of the state of Alabama. So our core services really go the full extent of the state. Our overall mission for our aging network in Alabama is aging in place. So we really try to promote or have programs in place that support families to really try to make it at all possible, if at all possible, age in the community and stay there for the remainder of the time that you would like to remain in the community. So 90% of adults, this is a stat that we always include in here, but 90% of adults age 65 and older want to stay at home. So what other way of doing business than try to help age in place? So we really love that motto as an overall aging network. Our mission in-house for M4A specifically is to empower individuals, people living with disabilities, and their caregivers to self-advocate, as well as live independently and safely in the communities of their choice. And our agency's motto here in-house is assisting all ages at all stages. So we have we'll go over in just a couple of slides, but we have services that really cover the full spectrum of life to try and help any way we can. Specifically, the counties that we cover here for M4A are Blount County, Chilton County, St. Clair, Shelby, and Walker counties, but we also cover Jefferson County for our senior employment program. The way it starts for our agency and really across the whole entire network is we have what's called an ADRC, or an Aging and Disability Resource Center. And it really just serves as a single point of entry for long-term care services. That's kind of our starting point. That's, like I said a while ago, no wrong door. It's really just the starting point for us. You go to that one spot, you get referred to our services. They do a full benefits screening, and they will make a referral over to any of the programs that they think that might be beneficial for your situation. So typically, we have calls for one specific thing, like Justin was just talking about, medications, or be it food or transportation, and you end up walking away with many other resources, because we too are a resource center outside of a direct service provider in the community. So of course, we always try to empower individuals who are calling in to make informed decisions with their own long-term care support services. And if you try to reach us and you're unable to remember our phone number, you can always just call 1-800-AGE-LINE, which is our statewide number that will connect you to your local area agency on aging. So that's really important for those that may live in a bordering county. They will get you back to where you need to be to get things started for you. You can also make an online referral now. This seems to be the preferred method during the pandemic. This is something that you can do kind of on behalf of someone else or in your own free time. It really just makes it a little easier than calling in and doing it kind of the old-fashioned way, or walking into our office or mailing us through standard mail. It's really just a quicker way of doing things, a more efficient way of doing things. So you just visit our website at www.m4a.org/referral, and it will reach you with some information that you can fill out, some services that you might be interested in or inquiring on someone else's behalf for, and it will send it to our queue to get back in contact with you again to do that full benefit screening, to get the referrals to the programs that might be beneficial for your situation. Some of our core or key programs that we offer across the state of Alabama, this is really something that's offered, or these programs are offered really throughout the state of Alabama, with the exception of our PANDA project. But we have our nutrition program. So we have an elderly nutrition program. We partner with the senior centers to offer the meals within the senior facility, as well as homebound meals, as well as frozen meals with some of our other programs. We also have caregiver supportive services with our Alabama Cares program across all 5 counties, and our PANDA project that's in Shelby County specifically, and that specifically provides assistance to those living with Alzheimer's or dementia-related diagnosis, as well as those living with IDD who are high risk and dementia-related diagnosis as well. With Alabama Cares, it's a little differently. It's specifically for caregiver supportive services, so we're there to serve the caregiver both physically, financially, whatever the need is. We do have limitations, but it's there to provide education, respite services, supplemental services, support groups, all sorts of things. And we do quite a bit of things to partner with the PANDA project, especially with key services like our coffee break series. So be sure to check us out if you're in need of any caregiver support services. Back to medications, we have a program in-house that serves, there's eligibility criteria for each of our programs, some different, much different than others because of the funding streams that they receive. But one of those in particular is our medication assistance program with our senior RX program. They too work directly with manufacturers to get low cost or no cost drugs for those that may find themselves paying for medications or have no insurance coverage, dependent on financial, I don't know if it's as much financial as it is age and whether or not there's insurance involved. So if you call in, they can tell you a whole lot more about that than I can. With our insurance counseling, as most of you know, we are being bombarded right now with advertisements on TV for Medicare plans, Part B, Part C, the rest of the alphabet. And the SHIP counselor that we have here in-house, Ms. LaToya Shelton, is an expert when it comes to screening individuals for Medicare plans. She does it from a non-biased standpoint, so she can do one-on-one counseling with you during this open enrollment period that ends in December to look at your Medicare plans to see if the plan that you're on is the best fit for you, or if there's other options available. and really try to give you a non-biased, non-threatening type options there to be able to get yourself some coverage there. So again, we have a senior employment program, and in short, what that program does is it finds wonderful organizations like the Community of Hope Clinic to do things like whatever across our for this particular program is 6 counties that includes Jefferson County, but we have we specifically partner with nonprofit organizations to provide individuals who are at a certain age, they're looking to get back into the workforce. We provide a stipend to help pay for their time while also benefiting the 501c3 and nonprofit organizations to provide them with job skills to hopefully, the ideal goal there is to do some long-term job placement, whether it be with the organization that they work with us through or another organization throughout the community. And so that's really a great program as well. We also partner with an elder law attorney out of Opelika that assists us with, especially for those that are 60 and older, to provide powers of attorney, advanced directives, different things like that as part of our funding that we receive for that. So if you find yourself in a situation where you need some legal guidance there, that's potentially a service that we can help take care of as well, powers of attorney especially. So be sure to check that out, and if you need any assistance with that. We always have an initiative across the board to do elder abuse prevention programs. We have a series right now called Take a Stand, as well as many other programs that we have throughout the years where we do both virtual, especially for 2020, both virtually and in person to always be advocates for elder abuse prevention and try to empower individuals in the community to be proactive against elder abuse and et cetera. So we're really proud as a whole, as our entire network, to be very prideful in that we really appreciate the efforts that we put in place to prevent elder abuse. Our two biggest program, or really our largest program, as well as the long-term care program, our ombudsman program, we have a Medicaid waiver program that offers supportive services primarily for those individuals who meet both financially and physical criteria to go into nursing home placement or some type of long-term care facility. And what we do with that program is we bring in services like homemaker services, unskilled respite services, personal care, whether it be frozen meal delivery, things like that. We bring those services into the home to hopefully delay or prevent long-term care placement. So, because sometimes it's really just a little bit of help the families need, and that of course allows families to help age in place, as well as saves taxpayers an enormous amount of money, because the alternative, of course, is a long-term care facility, and that isn't exactly the cheapest tab these days. So another great program that's really, again, that's our largest program at house. If you find yourself or a loved one in a long-term care facility, we also have a long-term care ombudsman who is kind of like the middleman or middlewoman for the facility, as well as the resident to see what, if there's any kind of issues that need to be mitigated or looked at and investigated. He can kind of help direct and coordinate, and any information that's given to him, if need be, can go to higher authorities to really make sure any issues are taken care of. So that's pretty much our core programs. Really, we have too many to list. We always have bright ideas that pop up that we try to put into our communities, especially here at M4A. But we have quite a bit of other resources as well, like I said. So if you call in, you may be calling for senior employment, you may be calling for insurance counseling during open enrollment, but you may walk away with food assistance program. You may walk away with community clinics like the Hope Clinic that can help in your situation. So always reach out. If it's better for us to say that we don't know of a resource than to not try. I mean, we really have some staff here that are very quite the experts in their field. So feel free to reach out, and we will certainly see what we can do to get you some help for your family. As far as our social media accounts, of course, we're on all the big ones. We're on, of course, Facebook, Twitter, Instagram, and our YouTube channel. As far as Facebook goes, the PANDA program, our Alabama Cares page, we have one for our Living Well Alabama initiative and our Alabama Cares program. So quite a few pages there. We all coordinate with each other. We share these videos. So if you miss us on our PANDA page to find this video, you can always catch it on the M4A page or on our Alabama Cares page. So feel free to follow us, like us, share us, do whatever you got to do to get the word out about who we are and what we do. And especially, like Justin said, if there's ever any volunteers, we love those too. So reach out to us on our accounts if you have any questions about anything as it relates to M4A. Of course, when you go to our website, which is www.m4a.org, you will be greeted by a little prompt that you can't really outrun unless you click the little X box at the top right corner, and it'll ask you if you want to join our newsletter. We encourage you to do so. We send one of those out. Many of our programs have their own newsletters, but we have one main newsletter that we send out to the community weekly. And so if you've got any events that you want to add to that you think might be relevant to those that we serve in our communities, if your organization, especially nonprofits that have an event that's coming up that you think might be relevant, feel free to reach out to us. We can't guarantee that it will make it to the newsletter, but it might be a useful event that could really impact families, and we can help you get the word out about it. But we also put our own events, other legislative things, or hot topics, or whatever's going on. Robin just really gets creative with putting things in the newsletter. So feel free to sign up for that and kind of keep in the know what's going on here in the Central Alabama region. As far as our contact information, you see it here on the screen. We're located at 209 Cloverdale Circle in Alabaster. We're right across from the Saginaw Post Office on 31, Highway 31 going from Alabaster to Calera. Unfortunately, right now our office doors are closed, but if you have anything that you need to reach out to us on, feel free to. I mean, you can still stop by if you have an appointment. You can call our office. You can send us a letter at P.O. Drawer 618 Saginaw, Alabama 35137, or of course do it the way most people seem to be doing things these days, online at www.m4a.org, or of course on our social media accounts. So that's all that I have for M4A services. That's a lot of information from both us and Justin. Again, Justin, thank you for joining us today. It's been a pleasure. It's always great to hear about great local organizations that are helping the community, and that's quite the statement I guess you could use to describe them, because they do that and a lot more. They do an awesome job of serving Shelby County. So again, if you have any questions, just drop them on our Facebook video even after this event, and we can get back in contact with you once we post this, probably early next week. You can also drop a comment on our YouTube channel, and we can get any kind of information back to you or help you with any types of questions you may have, whether it be calling our agency to get screened for services or getting you back in contact with Justin and his organization. So thanks again for joining us. We hope everybody has a great rest of the week, and we will talk to you soon.